Many mothers notice engorgement or overfilled breasts at some point or the other while they're breastfeeding their baby, and it's especially common to experience when your baby's first born and you're just starting to make milk. So for the first couple of days you make colostrum, and then 2 to 5 days later your milk comes in, and sometimes it comes in with a vengeance, and all of a sudden you feel really full, and it can be painful and very uncomfortable. So normally your milk supply will even out and start to, work well with your baby's demand. So it's kind of a supply and demand type of function. But until then, if you feel engorgement, there are a few things you can do to relieve it. If you're nursing your baby on demand, this will usually help to self-regulate, and most young babies want to eat every 2 to 3 hours, and sometimes even every hour. So basically, the more often your breasts are emptied, the more relief you'll feel. But on the same hand, the more you nurse, the more milk your body will probably produce. And so this is why it's good to go off your baby's cues, because then you'll make what your baby needs and hopefully not much more. But if you are making more than your baby needs and you find that you're still full after feedings, you'll probably have to either manually express the milk or pump it off. So have a good pump available in case you need to. And if you don't, you can manually express the milk by gently massaging from the armpit down towards the nipple. And you can also try using heat prior to nursing your baby or pumping milk off. And this will also help to relax things and help you to get the milk out. Take a warm shower and then feed your baby, or use a warm compress. If this isn't helping, then you might want to use ice packs between feedings. And sometimes mothers even resort to using cabbage leaves. Cabbage leaves, for whatever reason, have been shown to reduce engorgement and help with the discomfort that comes along with it. Of course, there's red cabbage and green cabbage, and they both work the same, but green is probably less likely to dye or stain your clothes. So just get a whole leaf and place it inside your bra next to your skin and leave it there till it wilts, and then replace it with a cool one. One other thing you can try is adjusting your baby's position while you nurse, because sometimes babies are sucking really effectively from one part of the breast, but not effectively emptying other areas of the breast. So by switching up the position and aiming their nose in different areas around the breast, that can help to empty different areas that might not be emptied as well. So if you feel like there's a certain point that's fuller than others, aim your baby's nose towards that. If these things aren't helping, you might start to notice that you have a hard lump or a red tender area, and this may be a clogged duct. So do what you can, again, to continue nursing in spite of the pain. Use warm compresses or a hot shower before nursing to try to unclog the duct. You can gently massage it. And then if at any point you notice that you develop a fever or have signs of sickness like the chills, and then you're really hot, you're really cold, you may have mastitis, and that requires treatment. So call your doctor as soon as possible if you notice that. I hope these suggestions help you, and if you have any other questions in the future for me, feel free to ask them on our Facebook page at facebook.com/InnerMountainMoms, and recommend us to your friends and family too.